Welcome to America's Heroes Group.
Welcome back to America's Heroes Group, this time on our roundtable and our partner, the National Nurses United. Today is Saturday, September 16, 2023. September is National Suicide Prevention and Hispanic Heritage Month. Our host is Kelley. I'm Sean Clement, the co-host, Army National Guard veteran. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega of Scout to Honor Productions. And we have, once again, Adelena Marshall. She's a VA mental health nurse, and she brought us a panelist, Sandra Wilks. She's a primary care nurse, and we're going to talk about preparing for your upcoming appointment for positive outcomes. That's a very, very important topic, I think. So we're going to get into that. How you doing, Adelena? Can you hear me? Sandra, you there? You're still silent. Let's see if we get them on. I think they're raising them up right now. Can you hear me?
Yes.
There you are. So how you guys doing today?
I'm doing great.
Well, thank you.
So tell us, Adelena, what experiences have you had in your career? You've been a nurse for a long time, many, many years. What experiences have you had that made you want to talk about this topic?
Well, we're getting more and more patients coming into the VA, and we want to offer them support and encouragement and education on how to make that experience more meaningful for them. And that's why I invited Sandra to come on today. She is one of our clinical nurse specialists, and she's able to give them a wealth of information during this podcast.
So, Sandra, what can you add to that? So, what experiences have you had in your career that prompted you to kind of make sure that people have this information?
Well, to have positive patient outcomes, it's very important to make sure that there's lots of education and also to empower the patient in their care. So it's a collaboration. It's more of a whole health type of approach to make them aware of what medications they're taking, what disease or illnesses they have, what they can do for better patient outcomes and better health.
And so what are some of the things that make a negative outcome for the patient?
When they are not compliant with their medications, when there was a lack of follow-up, when instruction to the patient from providers and medical staff perhaps may not be clear or on a level of education that patients can comprehend.
Oh, so tell us now in detail, what are some of the things you want us to know about positive outcomes? How do we prepare for our appointments?
So the best thing for the patients and for the medical staff is when patients come to their appointments to bring a complete list of the medications that they're taking. Not just the medications that are being prescribed, but also any over-the-counter medications. They should really know the names, the dosage, and the instructions for all of those medications so we can provide the best care.
Now, with that tip, are there some helpful hints as to how? Because people that are older sometimes they forget, or they unfortunately sometimes misplace medications. I see my mom do that sometimes. But what are some of the things that they can do as a helpful hint to make sure that they have those medications or remember those medications? So if maybe they find themselves with a health emergency, and the doctor might ask them, they might not have all their pills with them at that time. The doctor might ask them, "What medications are you taking?"
So what we like to provide them with is an after-patient summary at the time of their appointments. What that does is it lists their entire healthcare team, and to list other medications, doses, and instructions. We ask that they hold on to that and use that as a reference.
Now, so let's say they have an emergency where they're not able to get to that. Maybe that's in a drawer somewhere at the house, and they're out, having dinner, and then all of a sudden, something happens and they need to go to the emergency room.
Well, depending upon which emergency room, if they come to Jesse Brown, they have access to their medications. If they go to an outside emergency room, we have a collaboration where ED doctors can always call our facility so that we can do a medication reconciliation.
And then is it a good idea to have a good relationship with your pharmacist and to ask questions so that way the pharmacist can kind of explain, like maybe what are some of the side effects of certain medications, or how do certain medication interact with others, things like that?
Absolutely. One of the beauties behind primary care is that there are pods which consist of a pharmacist, a social worker, an RN, LPN, clerical, and your primary care physician. Also an avenue for mental health. This allows for a complete collaborative approach for the patient in educating them and reaching the best outcomes.
So what are some other things you think are really important to prepare for your upcoming appointment?
So for those patients that check their blood pressure at home, we provide them with a blood pressure machine. We ask them to bring in that machine and to bring in a log sheet of all their blood pressure readings. We want to compare what the readings are that they're getting at home with what we get in clinic. We also like to check their blood pressure machine, make sure it's operating correctly, and make sure that they know how to operate it.
And what are some of the things you found when people bring it in? Are people doing a good job of measuring their own blood pressure using these machines?
A lot of patients are doing a really good job. When we issue the blood pressure monitor, we go through every step with them. On occasion, we'll have a patient come in that is somewhat confused. We can do a demo and then a return demo on the patient's side just to make sure that they're able to go through the steps to achieve the correct readings.
And what else would you want to recommend for people?
We would also like for them, if they check their sugars at home, bring in their monitors. It's for the same purpose, so they can review all their sugar readings throughout the day. If they've been hospitalized and discharged, it's really important to them to bring in the discharge information, any updated medication lists, and any follow-up services that they need.
And then what would you say is probably the most important thing, if you could pull out one tip that you should do no matter what? I would imagine bringing your medications in, because I hear that oftentimes with doctors. That is, I know, a big one. But what else would you say is probably the most important thing that people can do to have a positive outcome when they have an appointment?
They can bring in a loved one if they need somebody to help them ask questions or gain clarity. One of the programs we're starting right now is we're encouraging patients to write down questions. What are their thoughts? What is their purpose for coming in today? What's the goal that they want to achieve during their appointment? So that we're also including the patient in their care, so they're having a decisional input into what's going on in their health.
Now, when you bring up someone in, is it a good idea to have to keep a journal so that maybe and what are some people's thoughts when you recommend this as far as privacy goes? Who is the right person to bring in, and then is it a good idea to write things down and maybe share that so people have an idea about what is going on in your life?
Absolutely. So to answer your first question, it's up to the patient who they feel comfortable with in the room. It could be a spouse, it could be a brother or sister. That's absolutely up to them. Once they authorize a person to join them in the room, then there's no HIPAA violation. So it's purely up to the patient in their comfort level. The idea of the journal is amazing and fantastic. I have recommended this to patients when they have very complex diseases or illnesses or are having several appointments. Keeping a journal allows them to see the progression of their care and where they need to go for the next step. So they can use your journal for appointments, for specialties, for medications, whom they've spoken to, so that then they can build their own team and be able to communicate consistently for continuity of care.
Anything else like to add to those positive things that you can do?
There's one.
Number one.
Yeah, to add is that when patients come to the clinic, they also need to discuss with their clinicians and the nurses about their sleep hygiene, if they're having problems sleeping at night. Are they waking up in the middle of the night, going to the bathroom often? Because this can also trigger the nurses to ask more questions to, make sure they don't have bladder infections or prostate issues or perhaps sleep problems that will impact their care.
And I think you touched on a really important thing, Adelena, because I judge a good nurse, if I go to get any kind of care at the hospital or a good doctor, is how many questions they ask me. Because sometimes I'll just ask a general question and then you just you're forced to just ramble on and try to figure out and pull things out. And I often forget about a lot of stuff that I needed to bring up until after the appointment is over. I'm walking out of the appointment thinking that I'm like, oh man, I forgot to bring about this, and because I only had this at one point, but then this is bothering me now. So I think a journal could help with that. But Sandra, what types of things would you recommend to kind of get, if you have a doctor that's not maybe asking a lot of questions, I like the idea of writing your questions down ahead of time and bringing everything down with you, which could be done in a journal. It could just be a notepad that you just carry around to the appointment. What are some of the ways that you can do as a patient that you can use to try to have better conversations with your doctor? No, Sandra.
Well, again, using the journal, writing the questions down previously, I think you raised a great question. If the physician isn't asking the questions, the triage nurse, which is the first step to coming into the clinic, will be asking several questions. There's many different reminders regarding systematic body functions and vaccines, et cetera. That, too, will start to trigger those questions and start to pull out information from the patient.
Adelena, you'd like to add anything to that? What are ways that a patient can stimulate conversation if the doctor, maybe this doesn't have the greatest bedside manner, maybe they're not, they're more focused on research versus, working with hands-on with the patient?
Well, our doctors are there to work hands-on with the patients if they're in the clinic. However, patients or their loved ones can always Google maybe their symptoms and then bring that forward so that the nurses can make sure that the patient is telling us everything we need to know. Again, that list is very, very important. I had an appointment the other day, and I had written down some things that I had questions about, and one was about a new medication. So those are things that can start the conversation. Sometimes patients are a little anxious about having to go to their appointments, but we encourage them to keep all appointments, and that's important for continuity of care and for actually addressing some of the care concerns that we have along racial boundaries. So we have to be able to know what is going on. Discuss it with your caretaker, because perhaps if you're coming with someone, then they might be mindful of some of the concerns that you discuss with them, and they can share that with the nurses who are triaging them, and then with the doctors.
And also, I think chemistry plays a big part of it as well, because sometimes when certain patients might react or have better conversations with certain doctors than others. I mean, depending just personalities or style or things like that. Is it easy in the VA system to change doctors if you're talking to a doctor? And oftentimes, and I will admit, I mean, I've watched friends of mine do this where they don't feel empowered enough, I would say, maybe that's the best way to say it, to say, I don't communicate well with this doctor. The doctor seems nice and everything, but we're not on the same page. Maybe I should change doctors in the VA system. So is that easy? Is that an easy process to do, Sandra?
That is an easy process, and it does happen. And, you're talking about chemistry, it could be cultural, and it is an easy process. So we're very, very sensitive to that. If a patient feels that they're not being listened to or being cared for in a manner that they want, it's easy to have a reassignment. And the same goes with their nurse. If they're with the nurse and that's feeling uncomfortable to them or they feel they're not being heard, we can actually make that switch in staffing right then and there at their appointment.
Let me ask you this. Does that rub anybody the wrong way if a patient does that?
Absolutely not. Absolutely not. Because we have to remember the end of the goal, the goal that we want to achieve is to make sure that the patient's getting the best quality care. So you take the emotion out of whether somebody is not having a great conversation with me or a physician and they need a change. That's what is utmost important, is what they're feeling and what their needs are.
What are some of the most common complaints that patients have when their experiences? Because I would imagine negative outcome is going to lead to a complaint. So what are those most common complaints that you hear about? That's for either one of you. We can start with you, Sandra.
I think some of the most common complaints is that the patient feels that the employee is not giving them their full attention. And, sometimes we are distracted maybe by something that we had to get done right away, even though the patient is sitting there. So we do ask the patient to, to understand that we're handling multiple patients, and momentarily it may appear that we don't have we're not giving them 100% our intentions, but we are. Many of us do multiple tasking just to get things done, and I can see how that might happen.
Sandra, what can you add to that?
I would have to agree with that. I think on occasion I will hear from patients saying, you know what, I'm not being heard, I'm not being understood, and my questions are not being answered. And then when you hear those comments, then it does alert us that we need to maybe refocus, readjust to make them feel more comfortable. But as Adelena says, you were multitasking constantly, and you could have one veteran in front of you that's asking you 3 or 4 questions at a time, and you're trying to process each question. That can be interpreted as not listening, but we're just trying to address everything.
So out of all the things that you deal with when you're as a nurse, Sandra, and also Adelena, I'm thinking brings up to you, what are one of your pet peeves with things that patients do? Because I know patients aren't perfect. Patients, even though we might think or say that the patient's always right, is that really true? What are some of the mistakes that patients do that make their own situation worse than what it needs to be?
I would say the thing that stands out to me is missed appointments. Because in order to provide the care that the veteran is seeking, there has to be follow-up. And there are some patients, for a variety of reasons, that don't come to their appointments, and that can be a little disheartening.
And Adelena, what about for you?
Public needs to understand that we are very guarded about our veterans. And when they miss an appointment, we become concerned, like they're family members, where they're not just a number to us. We've grown to know these patients through the years, and so we get very concerned. So would encourage them to keep their appointments, or at least to call, so that we know that they're okay. I mean, I still think of patients that I've had over 30 years ago. That's how embedded we are with the care of our veterans. And we know our veterans have been through a lot, and we know that. And so that's why we uniquely prepared to care for them, and we know them. So we want to encourage them to keep their appointments. And if they feel they need another appointment, to come in or call and reschedule.
Now, what percentage?
Absolutely.
Go ahead, Sandra. What did you have to add?
And I was just going to add to that. Often when they're missed an appointment, or we will call them and we will check in on them. Sometimes we call the patients when they don't even have an appointment, because we know that they're going through a difficult time, whatever those circumstances are. And frequently we will just call them just to check in, just to make sure they're okay.
So what percentage would you say are seniors in your practice? That's for Sandra and Adelena. For Sandra, start first.
A great deal, because in primary care, that will, of course, our World War II, are getting less and less. But a great deal of them are seniors, because the baby boomers are getting into the senior world. We have a separate clinic, the OEF clinic, that sees primarily the 20, 30, and 40-year-olds. So a great deal of our population, I would probably have to say 80 to 85 are seniors.
Wow. Adelena, would you agree with that?
Well, yes, I work mental health, so we're starting to see many of our veterans who receive mental health care at the VA, aging, and we are very concerned, about their care, because many of the mental health patients do not follow up as they should, and then we see them and they have multiple comorbidities, and that's another reason why we encourage them to follow up or to come in. If you haven't made an appointment, then you can still come in, and then the VA do have clinics during the day that, like urgent care and even the emergency room, we we want to have our patients come to the clinic versus the emergency room, but we do have an urgent care area that they can be seen. So for those who get busy with life and say, oh, I forgot, I need to go see the doctor, just come in. Come in and see it.
And what challenges does that pose to planning the perfect appointment for a person, especially for the senior community? Since that's your biggest cohort, what would you say is really, really important, particularly for seniors, and making sure that their appointment have positive outcomes?
Well, the fact that they're welcome, first of all, and then that they understand that the VA is not like private sector. And so we welcome all our veterans whenever they need us. We're there for them.
We will not turn a veteran down, whether they have an appointment or not have an appointment. We will accommodate them in some manner and address what ailment or concerns or questions they have when they present to Jesse Brown.
But then also, too, these veterans, particularly older veterans, have specific needs that you don't typically see maybe in a civilian hospital. What are some of those things that, how do you address those issues?
I think transportation may be one, and then Sandra can expound on that. I do see where there's transportation offered, for our veterans. Yeah.
So a lot of our veterans, you're losing their mobility and their ability to move comfortably and drive. So there's actually several transportation opportunities. The VA, if the qualifications are met, the VA will come and pick up the patient, whether they're in a wheelchair or if they're bedbound. We coordinate through our social worker, through PACE for free bus passes. There's a disability PACE services that are also available, and we also utilize Catholic Charities, and there's also volunteer transportation services. Actually, depending upon what the circumstances are and the issues, there's many opportunities for the patient to get to the VA, and we can guide them through all that.
And another thing, and one reason why I'm going back to specifically focusing on seniors, is a lot of the seniors from the Vietnam era particularly had toxic exposure, and that's also come up again with Afghanistan and Iraq. And that's something I'm not sure how I would imagine that the VA sees a lot more of that, vastly much more of that than civilian hospital would see. And a lot of these things have the treatments the access to treatment has changed recently with the CARE Act, so more people now can go to the VA and get treated. What are some of the things that maybe veterans need to know about that to be prepared for an appointment when they're getting treated for these toxic exposures?
So since that was the PACT Act that was passed, I believe, this year, which actually recognized all the toxin exposures all the way from Vietnam to present. And so legislation has recognized that and realizes that there's medical ailments that are actually associated with those toxins. Every veteran that comes in, we screen them, each and every one, and ask if they've had an exposure. If so, where was it or what was the exposure? We give them information on that and a phone number to register. And so this is nationwide. It's a huge act, and they have had fantastic outcomes in the actualization that many veterans have now joined the registry, which means to the veteran that if they are having an ailment that's associated with the toxin, then they will have care, and then they will be followed. For those veterans that have had an exposure but not having a medical illness, once they register, it sets the clock for them, because we don't know what's going to happen to their medical conditions 10 or 20 years from now. So this has been a great piece of legislation where we've been able to address each and every veteran and document all of their exposures and make sure that they receive treatment for that.
I really appreciate your time, and I think you gave us some really powerful information. Once again, if I could run it down, it seems like one of the biggest things we talked about is making sure that you are listening to your doctor, but also bringing your medications in, whether a list of medication or just bringing in your medications. And then if you're going to the same doctor, they should have that information on the system. They should have that information listed in their databases. But then the possibility of keeping a journal, writing down your experiences in a journal, what's going on in your life, can really be helpful. And having someone there with you when you're going to an appointment. So that way, if there's questions you might have forgotten about or things that maybe you don't understand, there's someone there that can help you, particularly if you're a senior. I think that's really a good idea. So thanks for your time. I really appreciate the information you give us. Anything else you want to add?
I just wanted to mention one other thing, and that is once the patient leaves the appointment, if they have additional questions or something's not clear to them, they have the opportunity to call us or join My Healthy Vet, which is a secured email system. So the conversation can continue between nurse and patient or doctor and patient even after they leave their appointment.
I appreciate that. Adelena Marshall, VA mental health nurse, and Sandra Wilks, primary care nurse. Thanks for your time.
Thank you for having us, and thank our veterans and the public for listening. Thank you very much.
So veterans out there, make sure you connect with AHG, America's Heroes Group. You can reach us on americashg.org, our website. Also, you can email us at americashg.org. And also make sure you see us on Facebook and YouTube. There's a huge catalog of information in our database. If you go onto our website or our YouTube channel, you can see past shows and even just search different topics. You can learn about how to navigate the healthcare system and the VA system. Learn all the different things you need to know about PTSD. If you're struggling with anything in your life, use the tools and resources, and also reach out to the Veteran Service Organization that we highlight. Those Veteran Service Organizations can help you with a myriad of things and also make your life a lot better and easier. You worked for it, you earned it, take advantage of it. This is America's Heroes Group. We appreciate your time and you're listening. We can also hear us on WVON AM 1690 in Chicago. We'll be right back again next Saturday, 4 to 6 p.m. We'll see you next week.